Hello, caregivers. I just wanted to say that I'm so excited to be back and with another interview to bring to you. I had the privilege of sitting down with a man named Bob Blancato and talking to him about the National Elder Justice Coalition and the immense power and reach that this organization has. This first video, we talk about a lot of cool things. We talk about the actual coalition itself and how it was started. Very interesting story. And come to find out, I have a little bit of a personal tie to it. Please thank Bob below for everything he's doing. He's a great guy, very fascinating. And you know what? One day I do hope to meet up with him in person and pick his brain on some more things because he is a font of information. Hello, everyone. I just want to thank Bob Blancato from the National Elder Justice Coalition for joining me today. Bob, can I ask, what is your background and what led you to working in elder justice?
Well, first of all, Sarah, it's a pleasure to be with you, and I appreciate your interest in the subject. And my background goes back a while. I am an older adult in the classic sense of the word. And when I was a younger person, I worked on Capitol Hill and for the then House Select Committee on Aging, which was a wonderful organization that was a non-legislative committee that did work on pretty much every topic you could think of in aging, did hearings, did reports, did studies. And in the early 1980s, two of the leading members of that committee, the chairman, whose name was Claude Pepper, and my boss, named Congressman Biaggi, wanted to have a hearing about elder abuse because nobody was doing anything in that space. This was 70 years after the Child Abuse Prevention and Treatment Act had become law. And we were all of a sudden confronted with this relatively new issue called elder abuse. And we did these hearings, we did some reports, and legislation began to be developed, which we can talk about as we go along. Then that period of my life ended, and in 1994, I was appointed by President Clinton to direct the 1995 White House Conference on Aging. And during that conference, we had a bunch of advocates that came in and made elder abuse one of the primary topics of that conference. The conference passed a variety of resolutions on topic areas, and several of them around elder abuse. And then, well, maybe 7 or 8 years later, the Senate Special Committee on Aging began to look into more deeply the whole issue of elder abuse and realized among their findings was that less than 1% of federal money in the abuse prevention space was going toward elder abuse. And the chairman at the time, who was Senator John Breaux of Louisiana, said, we need to do something about this. And so they, in a method that was so wonderful, frankly, they sought every stakeholder they could ask to talk about what they should put into an Elder Justice Act. And we were very involved talking to them about it. And finally, in 2003, the Elder Justice Act was introduced. And Senator Breaux called me and he said, now, Bob, you've been around this town a while. You know, we need to sometimes form coalitions that have dedicated purpose, which is to get a bill passed. And since I know you, I'm going to ask you if you can create this, coalition. Let's call it the Elder Justice Coalition, because it was called the Elder Justice Act. I said, I'd be honored. And I reached out to my colleagues in the National Adult Protective Service Association, the National Long-Term Care Ombudsman Association, the American Bar Association Legal Commission, and the National Association of State Units on Aging. And I said, look, let's get this group started. And there was a press conference when the bill was introduced. We were introduced at the same time. And then from that point in 2003, we began organically just to say we existed. And at our peak, and I think we're still close to it now, we had about 3,000 members from all walks of the proverbial life, from national groups to state groups to local groups. And I've served as national coordinator since it started. And we'll probably get into this later, but our signature accomplishment, frankly, was the enactment of the Elder Justice Act in 2010. So it's been a long history, but it's one that I'm very proud of because we've taken an issue and tried to move it to a newer level of attention. But now I'm a tad frustrated over the fact that we have a stall going on right now that I need to find a way to break.
Well, you kind of jumped into that. My next big question, which is, I do want you to talk more about what the Elder Justice Act is, but this past June, your coalition published a critical piece in regards to the delays in government action towards screening elders for abuse. And this is something I'm extremely passionate about because it's something that's actually, innate. I mean, you have doctors and nurses that are in contact with these people, and it should be just, no question in regards to, screening these people. Can you share the background as to why this letter was written? And we'll start with that. Can you share the background to why the letter was written?
Well, as I remember it, the background was about this was a ongoing study and an ongoing process that where a number of people had pushed for elder abuse to be included in the screening, and it refused to be done. And we just found that to be very frustrating. And a lot of times policy can be dictated by research, and there's plenty of research that's been done in the elder abuse prevention space. And we simply could not understand why we have not reached that point when 1 in 10 people over the age of 60 are victims of elder abuse, why we couldn't make that fundamental step toward addressing a very important issue about screening. And so, it's customary for us as a coalition to both to comment on a lot of things, sometimes proactively and sometimes, critically. And, a lot of times I've learned, as you probably know, when you're critical, they listen to you. When you're saying good things, they're like, well, so be it. But it's consistent with, right now, for example, the fact that this issue that led to the passage of the Elder Justice Act was a bipartisan issue back in 2010 and years back. People like Senator Orrin Hatch, the late Senator Orrin Hatch from Utah, Senator Charles Grassley, who's still in the Senate, okay? Congressman Peter King from New York, who's no longer in the House, but he was Republican from Long Island, together with Senator Breaux, together with Congressman Rahm Emanuel, if you can remember that when he was in the Congress. They all worked together on an elder justice bill. But ironically, where things started to go off the tracks a little bit, and this is a worthwhile story, it's 2009. Okay, the Elder Justice Act had been put before the Senate Finance Committee several times for a vote, came out unanimously, but every time it came at the end of a session. So think of football, okay? The 2-minute drill, right? A lot of times you try to do a lot of stuff in that 2 minutes, and sometimes they get through it, sometimes they don't. Well, the clock ran out, and one more session of Congress. And Senator Hatch, staff called me and said, the senator would like to talk to you. It was the beginning of 2009. And I said, of course, and he said, Bob, as much as this bill is worth everything, it's a great bill, it's never going to pass by itself. We've got to find a bigger vehicle that's going to move out of our committee and get it on that bill. He said, we'll do that together. I said, thank you for your support, whatever. Well, it turns out that bill was the Affordable Care Act, okay, which started off as a bipartisan endeavor and ended up as a purely partisan endeavor, with no Republican ever voting for the Affordable Care Act. And Senator Hatch again reached out and said, look, they shut me out of this deal. I'm not in the conversations anymore, but I think this bill is very important. So I'm going to ask my colleague, Senator Lincoln, Blanche Lincoln of Arkansas, if she will take it and bring it over to the finish line. And I said, you're a statesman. Okay. You gave up something that you put years into, that you were a pioneer on. But you want to get it done. And so, but that doesn't mean we still have to work to get it done, because at one point there were 5 different Affordable Care Acts floating around. But the one that we knew was going to be the one that was going to be the main one was the one coming out of the Senate Finance Committee. And Senator Harry Reid was the majority leader at the time. And Nevada, as you know, has a big growing elderly population. And there was an elder abuse case that occurred in Vegas that ended up in the paper. And the reporter, said, what's going on in Washington about this? And I was asked, and I said, and I'm very confident that we will get this bill done. Then I called Harry Reid's office and said, this is what I said. And she said, well, thank you for that. And I think it's going to make it. And it did. And, but ever since that point, we run into problems. And we're at a point now where we cannot seem to get any Republican to join. The critical step in the legislative process is to introduce a bill, right? And ideally, in this environment, you want a bill to be bipartisan when it gets introduced. We have two wonderful champions who have been champions for years: Senator Ron Wyden of Oregon and Congressman Richie Neal from Massachusetts. They have introduced, extensions to renew the Elder Justice Act, several Congresses. But we keep trying to get a Republican to join them. And now, in the environment that we're in, unless you have a Republican ready to go with you, you don't even bother introducing a bill.
Well, we'll do a call to action soon. But there was when you mentioned there was an abusive case out of Nevada, there was one out of Detroit at the same time. Mm-hmm. And in fact, there's a very dear friend of mine who actually sat before Congress and recited her situation in regards to her aunt in Detroit. So she was part of that, and she created the form that actually ended up into the Healthcare Act for all nursing homes to have if a family thinks that there's abuse happening. So I'm very aware of that tumultuous time, and your work is highly regarded and very much appreciated because it's tough. The problem too, in the act, I actually printed it, the reference to them not wanting to continue. They with the oversight and screening adults for abuse. Part of it is intimate partner. And in the response that what's the organization? The USPSTF?
Prevention Services Task Force, yeah.
Right. They stated that they believe that women who were of childbearing age needed that support, but they specifically said they did not believe that elders needed it. But it is an actual fact that the largest growing population of people presenting with STIs or sexually transmitted infections are senior citizens. And they've been holding that reign, if you will, for the last 20 plus years. So they are a sexually active group. And so therefore they too have intimate partners, and there can be within that intimate partner abuse. So that part of it really hit me hard. And in the letter, a word was stated from your organization, ageism, which, in my opinion, completely encapsulates what's going on here. And we'll try to get a call to action in and how our watchers can reach out to their people and make some changes for this. The other thing that I really want to talk to you about as well, before we get into actual abuse and some information on that, during the 2020 shutdowns, which was very big, what changes did you see in rates or reporting of abuse in elders, or if you didn't see any changes?
Well, the reporting issue has always been a problem. The Senate Aging Committee estimated for every one case of elder abuse there is, they go 5 that go unreported. Mm-hmm. There have been studies that show in financial abuse, it could be as many as 1 in 20 that don't get reported. There is no indication. There's some signs that there's more education going on to help people understand where to report. Because a lot of reasons cases weren't reported was that people wouldn't even know that adult protective services existed.
Right.
Right. And that's a primary vehicle for reporting. Ombudsmen, right. Long-term care ombudsmen are important. They're critical to reporting cases in nursing homes. But theoretically, if not actually, everybody who works in the aging network, your area agencies on aging and your nutrition providers, they too have the capacity, and in some cases actually contribute to helping with reporting. I work a lot in the nutrition space, and for example, in the delivery of a meal, which happens every day across this country, they are in most cases doing a safety check at the same time. Mm-hmm. In other words, they're bringing a meal and a checking on the status of the individual. Okay, and if they see anything that's problematic, they will go report. So I see a little bit of improvement in that area, but again, it's going to be about how you raise awareness about, how to do the reporting.
Hmm.
What are you looking for? What
Right.
changes are you seeing? Like, for example, in banking, right?
Mhm.
There was this whole issue that required a bill to be passed called the Senior Safe Act, I think it was called. Senator Collins did, which took away the potential of a bank teller, for example, who decided that saw an unusual transaction involving an older adult. They would have liability if they reported it under previous laws. This bill said no. That is what we need to be doing. We need to get more information from people to be able to report cases of financial abuse or whatever. So little by little, we're making progress. But then, of course, then you run into the secondary issue, which is the adequate resources for adult protective services to do their work. I mean, we're struggling to get them funding the way they should be getting it, even though in the pandemic and during the pandemic, the Elder Justice Act prior to the pandemic had maybe gotten about $120 million in funding. Okay. When COVID scams began to proliferate and they began to infiltrate members of Congress's offices or members of Congress relatives, or whatever it could be, suddenly, in typical Washington fashion, they're like, well, this is terrible. Where can we put money? Is there a law we could put money into? Well, here we are, hands up, man,
Yeah.
and $376 million
Oh my. Wow.
went into the Elder Justice Act just during the pandemic. But the
That's crazy.
problem was that was temporary money. It
Hmm.
was, it was designed to do two things: combat, COVID scams and increase resources for existing entities to address issues around elder abuse.
Hmm.
And we say constantly in our efforts from year to year to get more funding, if you thought it was important then, why wouldn't it be important now?
Amen.
Right? So, but again, it's I'm not alone in this space. There are many people involved in human services work and social service and social care work who are trying to get their adequate fair share of dollars. And but we don't stop. And in fact, I just worked on a letter yesterday with Congresswoman Bonamici from Oregon, who's circulating a letter to try to get more money for elder justice funding in the fiscal year that begins October 1st. So anyway, I'm going on in all kinds of tangents here on your simple questions, but I
No,
hope it
that's
helps.
all right.
Hope
That's
we're
what
okay.
I laid them out for you to do that. But in COVID, did you notice an uptick in abuse reporting, or was there not really any change in reporting per se
Well,
noticeable?
the problem was you saw it afterwards.
Yes. Yeah.
More so the case. Okay.
Right.
What you were concerned about back in those days was the individual who was isolated,
Hmm.
who could be susceptible to being scammed or abused in that fashion.
Yes, sir.
So there were a lot of cases that started being reported to adult protective services later in the period of the pandemic. But if you ask people in APS today and nationally, because I'm proud to say they actually work in my same suite here in Washington, my office, the biggest reports they get are about self-neglect, which is
Oh,
a major component of elder abuse. Okay. You know,
really?
self-neglect is where their reports come in. And that is the saddest form of elder abuse that you could imagine.
So
Because
a family member would come in and see that mom is not eating or mom's not taking a medication. Is that kind of the situation, or?
no, it's more about the older person may have been cared for by that relative, but all of a sudden that relative decides they're not going to do it anymore,
Yeah.
leaving that older person to fend for themselves. And and that has happened apparently a lot more as time has gone on, because the whole now epidemic of isolation and loneliness on the part of older adults is a major concern, not just in the abuse space, but in malnutrition, in other things that we concern about. So there's now a new focus on trying to get the necessary resources in to address that.
Mhm.
But those reports were coming out later because, like for example, in the ombudsman, they had no access to the nursing homes during the pandemic. And this just came right after they were given the authority to go not only into nursing homes, but into assisted living facilities.
Yeah.
So it was an odd situation, but to their credit, APS and ombudsman kept at it, and waited for the chance to come in and resume their work. And to their credit, they continue to do a very good job.
Yeah, that's amazing. So are you with your coalition? I don't know if you would necessarily go into this space, but are you working with the organizations that are within your coalition to make sure that we come up with a, I don't know, framework to ensure that we never have these shutdowns again, that we never go through this? I mean, the stories firsthand out of this area in Michigan were unbelievable. The isolation and um, are you guys working on that, or are you looking to get people together to find a way that we can never have this happen again?
Now, you mean in terms of shutdowns, you mean
The
caused by the
isolation.
caused by the pandemic, or
Yeah,
shutdowns like when the
yeah.
government shut down?
No, I mean shutdowns in regards to pandemic illness, where you're literally isolating a human being,
Right,
especially an elder who needs that that human interaction.
right.
To give you an example, I want to tell you, I went and visited a county-owned facility in Michigan, did a tour with them, and he said, the administrator, that they saw it coming down the pike. They met with each other, the staff, and they came up with a plan before plans came around. They put up plastic, they did their PPE, they stocked up, and they had the least amount of deaths, and they were still allowed able to have some family interactions. Those are the type of facilities I think we should be looking at.
Mhm.
But is there anything that you guys can do up in, up in Washington to kind of, you know, get
Well,
that
it's interesting you bring that up, because you bring up a topic that's very controversial beyond this topic, meaning, mandates that are put down about, what you can do and what you can't do in given areas because of pandemics. I mean, just think about the vaccines, think about issues like that. Um, our belief is that to avoid situations like what happened in the pandemic, you have to have the adequate resources, so that if you have to spend more money on PPE and spacing and everything else, that doesn't become the reason why you can't do it, because you don't have any resources to do it. What we should have done after the pandemic was put together what a lot of states call rainy day funds. Okay, we should have done that on a national level. We should, call it emergency preparedness, whatever it may be, so that we would know better. Because I'll give you another example that I think is particularly good. Our friends in the elderly nutrition space learned very effectively. They were closing down their centers, the senior
Mhm.
center. They couldn't go there, but what were they doing? They offered grab and go meals that
Yeah,
allowed the people to drive up. Okay, because I went to a couple of these, I visited myself, and I remember they drive in the driveway. Somebody would come out, they look and see how many meals they needed to give them. Okay, and said hello at that point, looked in the car and everything else, came back, got the meals, came back a second time to give them the meal, and made another assessment of things. But meantime, there was some degree of interaction
mhm,
that was important to these people.
yeah,
And that was so successful that in the renewal of the Older Americans Act, which we expect to pass this year, additional funding for grab and go bills is being included. Okay, and that's just sort of acknowledging a good way to think, and then just giving it money to go forward.
mhm,
And so I think you raise a good point. I think that there ought to be that same kind of approach in thinking about how to prevent those shutdowns from happening in facilities, particularly when in a nursing home or an assisted living. If the family has no access, who are they going to rely on?
right.
Oh my goodness. Thank you, Bob, for your interview. That was just fantastic. The information was flowing. Do you not agree? But I just want to thank Bob so very much for his discussion, his knowledge, his amazing information, and I cannot wait to show more of our conversation in the future. Well, thank you so much, caregivers, for listening. Please remember to like the video if you like what I'm offering you. If you liked what Bob had to say, share this video with others, other caregivers, other people that need to know this information. And also, make sure you subscribe. There's so much more coming down the pike. If you have any new ideas or questions about this video, put them down below so that we can share them with others and we can make this the most amazing community of information and helping one another. Until we speak again, caregivers, just know that you are loved, you are appreciated, you are part of this amazing community, and I wish you blessings.